You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode I spoke with Dr. Beau Whitaker about equine asthma and EIPH. This episode of Disease Du Jour is brought to you by Equithrive. Dr. Beau Whitaker is a partner at Brazos Valley Equine Hospital in Salado, Texas. He was raised on a family farm in Tennessee before acquiring a BS in animal science from Oklahoma State University. After a gap year of training horses, he attended and graduated from Texas A&M University College of Veterinary Medicine in 2005. Upon graduation, he completed an internship at Arizona Equine Hospital and then worked as a veterinarian at the Four Sixes Ranch in Guthrie, Texas, before moving to Salado, where he has practiced since 2007. Dr. Whitaker is a certified equine rehabilitation practitioner and focuses his work in the areas of sports medicine, regenerative therapies, and clinical research. He has participated in multiple clinical research trials for equine therapeutics and performs equine product development research. He regularly speaks at conferences and contributes to publications. In 2022, he was named the AAEP Good Hands Veterinarian of the Year and PATH International Veterinarian of the Year for his work with therapeutic riding centers. Thank you, Dr. Whitaker, for joining us.
Yeah, thanks for inviting me, Carly. Happy to be here.
Can you start by briefly defining equine asthma and EIPH? What's happening in the horse's lungs when they have one of these conditions, and what are some of the key differences?
Yeah, equine asthma, some of the terms have changed over the years. So, people may be familiar more with some of the old terms. So one of the old terms is RAO, which stands for recurrent airway obstruction. And that generally refers to what we more call severe equine asthma nowadays. And then the other form of it is IAD, or inflammatory airway disease, which today we mostly call mild to moderate equine asthma. And so I just want to clarify that because sometimes those terms get thrown around and they've kind of changed over time, but sometimes people still use the old terms. So we can start with the more severe form, which would be severe asthma or RAO. And that's what is generally referred to as heaves. So I think most people, at least horse people, are probably familiar with that term. And it's the horses with that. It's more of a physical, like a clinical diagnosis it's pretty obvious because those horses are heaving, like those. Usually they're having trouble breathing, they're having increased effort. So we'll notice their rib cages are really going in and out. Those nostrils are really flaring. Sometimes they can even make a noise. And this is generally at rest without exercise. And so that's obviously the most severe, the most concerning form of asthma, because it can, there are horses sometimes that have to be euthanized because of it. It can get so severe because they can't breathe. And I don't know how deep in the woods we want to get on like immune pathways, but it's basically a severe immune response to dust, molds, things like that. There can also sometimes be an allergic component to it, but a lot of asthma is not actually an allergy. It's more of an immune response to dust and molds in the environment. So the severe form is that they get severe bronchoconstriction. So the airways start to collapse down. Little areas that are in the lungs, the alveoli, really start to collapse down. And so it doesn't leave much room for them to breathe. On top of that, they're producing lots of mucus. And so the lining of the lungs produces mucus as a protective mechanism, but then it also starts to obstruct the airway. And so there's just not much room for air to move through the lungs. So that's kind of the gist of the big picture of what's happening. And then when we talk about our mild to moderate asthma, usually those horses, we don't see any outward symptoms when they're just at rest. So you look at the horse standing there, it looks normal, looks like it's breathing normal. But usually what we notice when those horses when we start to ride those horses and start to work them and they're having to breathe a little heavier, sometimes they'll start to cough. It's one of the first symptoms people will notice. Sometimes they cough at rest too, but I'd say the most common symptom we hear from clients with that is, I'll start riding my horse, it'll cough 3 or 4 times, or it'll cough multiple times throughout a ride. And sometimes they may or may not cough when they're at rest. Those horses often also have an inability to recover as quickly after exercise. And so they'll notice they may get winded faster, than normal, where it seems like they're just kind of running out of breath is a term we'll hear sometimes from clients, faster than they normally do. And then after they get done riding, it takes them a long time to recover, to start breathing normally, to kind of be the normal selves again after they ride. And so that's more the mild type asthma. With that, you don't have such the amount of bronchoconstrictions, the narrowing of airways that you do with the severe. and oftentimes less mucus production as well. So it's just a different scale. They're almost different diseases in some ways, but the severe form obviously is just you've got more mucus and more constriction in the airways. So, and then with exercise-induced pulmonary hemorrhage, so that's what EIPH stands for, exercise-induced pulmonary hemorrhage. And so that comes down, it's kind of a physics problem in some ways. So horses have a great design to be able to run really fast and move a lot of oxygen quickly. So like if we talk about a racehorse that's running, or any horse that's running as fast as they can, they're breathing in about 4 gallons of air per minute. So that's a lot of air having to move through those airways. So there's always have to open up and allow that air to move back and forth. And the heart's beating 4 times per second at the same time. And so the lungs, the reason a horse is such a efficient mover and can run and move so fast is their ability to process that oxygen. And so there's little alveoli in the lungs. They're half a micron thick. So that is really tiny. But the reason they're so thin is that they can effectively move carbon dioxide and oxygen in and out of them as the horse is running. And so they can really efficiently process that oxygen. But it also makes them more susceptible, because they're so thin, for them to create little fissures and for blood to get out of those vessels into the lungs. And so when you have that really high pressure, that heart beating so fast is making those vessels expand in the lungs. And then on the other side, you have those air pressures that are a negative pressure that's pulling. So you have a push and a pull. And eventually that gets high enough that those vessels start to fissure and we get blood in the lungs. And then we have the EIPH. And so what we usually see that in is most commonly in racehorses. There's been some studies that show basically 100% of racehorses have EIPH. Whether they bleed from the nose or not, oftentimes, obviously, that's the most obvious result is the bleeding from the nose, or what we call epistaxis. But a lot of them don't bleed out, like they'll just bleed the trachea or just in the lungs. So it's kind of hard to know sometimes. Another study showed about 30% of all other types of horses have EIPH. Now, I think in race horses, like bell racing horses, it's probably closer to the 100% that we see in race horses. We work on a lot of bell racing horses in our practice, and so it might not be 100%, but it's probably, I bet it's up close, 80, 75, 80%, or at least somewhere in that area. And then your emitting horses, quite commonly, will show epistaxis or EIPH, and sometimes also your show jumpers. So it's less common in things like Western pleasure or events where they're not having to fully exert themselves and breathe as hard as they can to move those muscles.
Right, that makes a lot of sense. Yeah, I think that's a great overview of both of those conditions, and I'm looking forward to diving a little bit deeper into both of them. So I guess let's start with equine asthma. How often do you encounter this in practice, and are there any known risk factors or any horses that you find are most prone to it?
Yeah, it's often a seasonal disease, and it'll be, sometimes you'll see in different parts of the country, different times of year. But for us, it's generally like this time of year in the spring, we'll start to see those cases. And it'll get worse through the summer. And then usually for us in the winter, it's much less prevalent. And so that's, sometimes in northern states, it can be a little bit different, because oftentimes in northern states where it's cold, really cold in the winter, horses will be put up in barns. And so they have much more exposure to dust. And so I know sometimes in colder areas, sometimes they'll see a lot of cases in the winter because of that. Here in Texas, our winters aren't bad. Horses are still turned out a lot. And so here our cases go down quite a bit. In the winter time, we see it. Really, all breeds are affected because it's mostly exposure to dust and molds in the environment. Probably the biggest factor is round bells that we see, because those round bells have a lot of dust in them, and the horses will just put their face in that round bell, and as they're eating, they're inhaling all this dust while they're eating. And so round bells seem to be a big trigger. Sometimes horses, we can get them better just getting them off the round bell. So that's a big trigger for us here. Is very, very common in barrel racing horses. So we do lots of DALs, which is a diagnostic tool for asthma and for EIPH. And almost every barrel racing horse I look at has asthma to some degree, based on the cell types that we see in their lungs. And so probably for us, the largest discipline we see with asthma is barrel racing horses, but we certainly see it across all disciplines just because of the environmental factors that are common between all barns and environments. And there's 2 types. There's a summer pasture associated, which is probably what the more type we see here, where horses get, grasses and different things that are present on the pasture triggers them. And then you have the kind that's more like horses that are up in barns that are dusty or triggered. So there's kind of two different types there for asthma.
That's interesting about barrel horses. Do you think that's related to how they're managed typically, or the work that they're doing, or is there a genetic factor to it?
Yeah, I think it's a couple things. I think one is they're, especially ones that are running a lot, like, here in Texas, they're going to rodeos pretty much every weekend throughout the spring, summer, fall. And so those horses are running, as hard as they can for about, between 16 and 18 seconds, stirring up dust. And so as they're running, they're stirring up dust and they're breathing as hard as they can. So I think, when they're doing their job, they're breathing in lots of dust and dirt. So I like that's one big factor of it. Now I think the other one's just environmental. Those horses get hauled a lot in trailers. They're, the environments differ quite a bit with the rail racing horses. Some people live them out all the time on pastures. Some of them have them up. And so I think it's a combination of environmental conditions and their jobs, I think, is why we see so much in rail racing horses.
Interesting. This episode of Disease Du Jour is sponsored by Equithrive. Brought to you by Equithrive, the leaders in resveratrol science, Medicare is a new pelleted daily supplement offering metabolic support for easy keepers. Medicare is formulated by Pat Lawless, PhD, to support optimum carbohydrate and fat metabolism, healthy body weight, and appropriate insulin levels in horses, thanks to a proprietary combination of resveratrol, flavonoids, and amino acids. Learn more at www.equithrive.com. So I know we touched a little bit earlier on some of the common clinical signs, but are there any others, maybe subtle signs that could be easy to overlook that you think are worth noting?
Yeah, mostly it's going to be the real subtle signs are exercise intolerance that we see for the horse. We see quite a bit, especially in barrel racing horses, where the horses aren't coughing. They're not showing any typical symptoms you associate with asthma. And so those horses will just start to slow down a little bit, and we see that in other disciplines too. But the owners will complain, the horse just kind of acts lazy, like it's not able to give its all. I was able to get the horse going and running and trying hard, and now it just seems like it's not trying anymore. And that's probably the most subtle sign we see, and that a lot of the owners don't even associate with being something wrong with their lungs. Sometimes they think the horse is just being lazy. That would probably be the main one, outside of the more obvious for like horses are having little coughs or things like that.
And then what does the diagnostic procedure entail?
Yeah, so with severe asthma, it's usually pretty obvious because those horses are just really struggling to breathe, and those rib cages are going in and out, real exaggerated. Now, with those, you want to rule out that they don't have like pneumonia or something infectious causing it, those things. So once you kind of rule out infectious causes, then the diagnostics on those horses, we don't, so we'll pass a scope, look in their upper airway, and then pass it down the trachea. And so there's a high correlation between mild to moderate asthma and mucus in the trachea. So we have a mucus scoring system that we use to grade the amount of mucus they have. Especially there's three main cell types that cause asthma of the immune cells, and neutrophils are the most common one that we see. And so there's a high correlation between neutrophil cell counts, like on BALs and mucus in the trachea. So that's a pretty good indication if the horse has some symptoms that you see, plus you've got quite a bit of mucus in the trachea. That's a pretty good indication they're probably dealing with equine asthma. Now, the most definitive way is to do a bronchial alveolar lavage, or BAL, as I've been referring to. What this involves is passing a small tube down into their lungs. And you can do this with an endoscope or without. You do it blind. We typically do it blind. And you inject sterile saline into the lungs and you draw it back out. And so then we send that to a lab called the Equine Lung Experts at Purdue University. And they do a cytology and they analyze the types of cells that are in that wash that we get back. And so there's kind of known quantities there or percentages of the cells that should be normal in a normal horse. And so if they're over those numbers, then we know that it's asthma. And sometimes it's helpful for those, like some horses I'll test, I already know they have asthma, but I want to know the cell types, because sometimes depending on the cell type, you might treat those horses a little bit differently. And so that's one of the advantages to having it, even if you know the horse has asthma, to getting a BAL performed, is it can help you target your treatment more effectively.
Okay, interesting. Yeah, so I guess on that same note, what do the treatment options look like for asthma, and what are some of the non-medical management strategies that are helpful as well?
Yeah, so the thing we start with, which isn't really a medical treatment, I'll kind of answer your question in reverse. So I think every horse needs to have the environment and feed assessed, because that's probably where you can make the largest improvement in a lot of these horses is, like I said before, if they're on a round bell, you've got to get them off the round bell. Like that's just a huge trigger. And so we'll start there, assess their hay quality, kind of how they're feeding their hay. It's usually a little bit better to have the hay on the ground because their head's down, and as opposed to having it in the hay net, that can help. Sometimes we'll have them wet the hay or steam the hay. Steam the hay is the best. If you get a hay steamer, that'd be the ideal way to feed hay. We also assess the grain, make sure there's, you're going to minimize dust in the grains. There's only really one supplement that's really been shown to be effective, which is marine-derived omega-3 fatty acids. And so there's 2 products that we recommend there that the horses get on, because that has shown in some studies that it can improve the symptoms of those horses and improve their VAL cell counts as well. And then beyond that, we start talking about our medical therapies. Usually it depends on kind of the severity and which type of asthma we're talking about, but usually some kind of corticosteroid therapy is going to be the most effective, at least initially, getting that inflammation down. Now, we prefer if we can do that directly into the lungs. And so there's an inhaler that's made that's actually going off the market, unfortunately, that can be pretty effective, especially for our horses with heaves or severe asthma. But usually especially if these horses are going to require ongoing maintenance, we encourage our clients to get a nebulizer. And so then they can do direct treatment into the lungs that the horse inhales. And so that usually includes some combination from a medical standpoint or a pharmaceutical standpoint of some kind of corticosteroid. And we worry about systemic corticosteroids oftentimes, especially in long-term use, because of all the side effects, especially if a horse has any metabolic issues. If they have Cushing's, then we risk creating laminitis in those horses. And so we certainly don't want to do that. But the inhaled corticosteroids have been safe. Oftentimes we'll have a bronchodilator in that nebulizer that helps to open their airways up more so they can breathe better. And then oftentimes we'll also have a mast cell stabilizer, because mast cells are one of the types that we see quite often elevated. And when they degranulate or break down in the lungs, they release all these things that cause inflammation. So this keeps those cells from breaking down. And so oftentimes we'll use some combination of a corticosteroid, a bronchodilator, and a mast cell stabilizer from a pharmaceutical standpoint. Now, in the last couple of years, there's been some other treatments that are non-pharmaceutical treatments that can be very effective. And so one of those is inhaled biologics or orthobiologics. So that includes things like plasma, platelet-rich plasma, IRAP, A2M is a product that's often used that way. And we use those quite a bit. There's also an amnion-based product that can be effective. And so these are our regenerative therapies, the kind of term that you often hear used, that we're using instead of pharmaceuticals in some cases. Sometimes I use both. We'll start with sometimes regenerative therapy and then try to maintain. If we need some pharmaceutical treatment after that, we can go to that. And also something that I've been researching for the last couple of years is shockwave of the lungs, which is a novel treatment. We're still doing the research on that, especially for asthma. We looked at it initially for EIPH based on some person in Florida that was doing it on racehorses. And then I did a study on barrel racing horses for EIPH with shockwave. And then I've recently done a study for asthma. It was very effective for asthma. We used a scoring system where the client scored improvement in the horses, and the average improvement was 68% on those horses that we treated just with shockwave without doing anything else. So I think in some cases that can be effective. Most of these are going to be most of these cases, we don't use one treatment. We're typically, certainly doing environmental controls and looking at what they're eating with a combination of other treatments that might include shockwave therapy, regenerative therapies, and pharmaceuticals. And so we kind of take a broad approach to attacking it. And obviously prevention is the best medicine. That's why we always start with environment first.
Yeah, it's really fascinating to me to hear how far treatment has come over the past few years. And now with the shockwave and the orthobiologics, I think horses have so many more options now than they used to, which is really exciting.
Yeah.
How effective do you find treatment typically? Can horses continue to perform? Are they often retired? Can they have a decent quality of life if they are retired, or is this very horse dependent?
Yeah, with the severe asthma, the heaves horses, typically they're not able to continue to perform, especially if they're a performance horse. Some of those horses can continue to do some light work. Some of those are seasonal too. Like I said, like we get some of those horses where it almost goes away in the winter. And those horses can be usable sometimes seasonally. We can usually improve that or control it, but oftentimes it's hard, sometimes seasonally, to keep those horses in work. Our mild to moderate horses, we can typically keep those performing at a high level, with the management practices that I mentioned earlier. So those are less difficult generally to manage than the severe cases from an aspect of keeping those horses in their intended use.
Yeah, I've seen some horses with severe asthma that their owners actually have tried to sell into colder climates and just, completely change the environment that way. So I guess transitioning now to EIPH, do you find that there's any sort of connection between these conditions? Does one predispose the horse to the other, or is it something that's more random and disconnected?
No, I think asthma is definitely a mitigating factor for EIPH. Now, it doesn't. All horses with EIPH don't have asthma, but I think any horse that has a decrease in their ability of their airways to move air, that can impact EIPH because it increases. We were talking about those pressures, talking about the negative pressure on the outside of those vessels that pulls the vessel. When you get a horse with asthma, that increases the negative pressure, that pull. And so I think that increases the likelihood of those vessels rupturing. And so we very commonly, very, very commonly see asthma associated with EIPH. And so a lot of our barrel racing horses that we look at, I can improve their EIPH by treating the asthma, not necessarily the EIPH. And I see that every day on those horses where we target the asthma. Now you're also doing some things for EIPH. Usually those horses are already on furosemide from a barrel racing horse standpoint. And they're bleeding through it. They say bleeding through it. They're giving them, that's the term they all use, is they're giving them, Lasix or furosemide, and they're still bleeding, usually out the nose. Those are the more severe cases. And so a lot of those we've been able to help by treating the asthma. Now, I don't think EIPH really has much of a contribution to asthma, though. I don't think EIPH causes asthma or makes asthma worse. But the other way around, I certainly see that clinically in practice, how the asthma seems to make the EIPH worse.
Yeah, that makes a lot of sense. Besides nosebleeds, what are some of the more subtle signs of EIPH that you might look for? Or is it something that you just automatically try to look for if you're diagnosing a horse with asthma?
Yeah, there's, as far as EIPH, there are some symptoms, like most of the horses that have it aren't bleeding out their nose. So, it can be difficult for an owner to know that they're bleeding. It's so prevalent in barrel racing, and that's where we see it the most. So I'll kind of use some examples of subtle things that we see there. Sometimes those horses, they'll round the third barrel, which is the last barrel, and they kind of have a straight run home. All those horses, after they run that third barrel, they'll start to kind of feel that bleeding, and they'll kind of pull up. So we'll see that sometimes. So that's kind of a subtle symptom. Sometimes they'll start to cough kind of at the end of the run or after the run. That's another thing we'll see sometimes because that blood's in their getting their trachea and they're trying to clear it, and so they'll kind of start to cough to get that blood out, which always doesn't always come up, but they'll start to cough to try to get it out. Some of those horses will get apprehensive about going in the arena. And so we've had quite a few horses where the horses were fine going in the arena and run, and all of a sudden they don't want to go in. They have to make them go run. And so that doesn't mean that's EIPH. There can be other things. If something's hurting on the horse that may not want to run, that's a common symptom we see as the horse is starting to refuse to go in the alleyway because they're expecting that bleeding and they don't want to have to go run because it's uncomfortable to them. So those are the most common things we see as far as EIPH is other than blood coming out the nose.
Is the diagnostic procedures for this condition similar to asthma, or is there anything specifically that you would do to test for this condition?
Yeah, it's the same as asthma. When you scope the trachea, especially you have to do it pretty soon after they run to be able to see it, like within a day or so typically, and you'll see blood in the trachea, which is obviously diagnostic. But there is a good percentage of horses that don't even bleed into the trachea. It's only in the lungs. And so a study was performed where they scoped the horses and did BALs, and the BALs was a much more sensitive diagnostic tool for diagnosing EIPH. So there was quite a few horses in that study that were bleeding in the lungs but showed nothing in the trachea. And so just because you scope a horse and there's no blood in the trachea doesn't mean there's not blood in the lungs. And so we do sometimes do BALs to diagnose EIPH and you'll know it immediately when you pull pull the saline back out of the lungs, it's red. It looks like blood.
Right.
Those horses have bled. So,
yeah, that's a good point. What does treatment look like for this condition? And I guess medical treatment and non-medical management options, is that also similar to asthma, or does this require a unique approach?
Yeah, it's a little bit different. So the furosemide is the most common thing used. It's depending on the sport, it may not be legal, so it's becoming not allowed in some tracks, and in the racing industry is trying to get rid of it. If you're jumpers, if they're doing FEI or U.S. equestrian events, then that they can't give it. In the barrel racing industry, for the most part, it's pretty wide open, so there's no regulations there. So they use furosemide typically like somewhere 2 to 3 hours before is typically how it's used, IV or in the muscle, and it's effective. So the studies on it, there's been some meta-analysis done, and it's somewhere around 68% of horses, they decreased them by 1 score on a tracheal blood score using endoscope. And so it's probably the most effective thing pharmaceutical wise. There's the nasal flare strip, which I think most people have probably seen across the nose band of horses or across the nasal bands of those horses. There's 3 or 4 studies performed on the racetracks in Florida looking at that. And that can also be effective in decreasing EIPH because it just opens up those airways more where they can move air. And so it's decreasing that pull that we talked about, that negative pressure in the lungs. And so that can be an effective thing. So those are the only 2 things that really have research behind them so far. There's a lot of other things out there like Kentucky Red, aminocaproic acid, which is also called Amicar. Those are probably the other 2 most common things that are used. There have been studies looking at those. In the studies, it showed they were not effective and did not decrease EIPH. And so, but clients still use them quite a bit. And at least in the barrel racing industry, they used to be used on the track a lot, sometimes still are, depending on regulations. But really, the only 2 things that have really been shown to be effective from a research standpoint are furosemide and the nasal strips.
Nice, interesting. What does the long-term prognosis look like? Can these horses typically continue in racing or in sport with proper management, or is this also something where they might need to step back and retire?
Yeah, certainly horses have retired because of it. Sometimes it gets so severe, those horses just bleed out the nose every time they run. And those horses, and it's progressive because when they bleed, it each time they bleed successively, it creates some fibrosis in the lungs. So it gets some scarring in the lungs. And so then the lungs can't function as well as much and move as much air. So it almost becomes at some point like a self-perpetuating problem because the more bleeding, the more remodeling in the lungs, the less effective the lungs are at moving air the next time they run. And so it can just become worse and worse over time. We have, some of those horses we have been able to get back. The ones that we can help are the ones that have asthma. Typically, I've had several that were like that. They're about to retire and we treated their asthma and they were able to continue running. Now, if they don't have asthma, they develop all the scar tissue in their lungs. Those horses are more difficult to treat. The severity of bleeding matters. So there's been quite a few studies looking at the correlation of like how severe they're bleeding to the money they win on the racetrack. And the ones, say generally, if you're looking at a bleeding score, say from 1 to 4, the ones that are 3s and 4s, those horses don't earn as much money as the ones that are 1s and 2s. So at least on the racing, the mild bleeding doesn't seem to be as much of a factor as far as ability to perform as the more severe cases do. And so, like I said, like 100% of those race horses are bleeding. Obviously, we have horses that have great careers and really run well, but the mild bleeding doesn't seem to affect them as much when they're running. So,
right, yeah, that makes a lot of sense. Yeah. Well, I think this has been a great overview of these respiratory conditions. Do you have anything else you'd like to add on the topic before we wrap up today?
Yeah, I think there's a lot of over treatment sometimes at EIPH, especially in barrel racers. Like they just throw everything at them. There's all these supplements out there. I won't mention names of them, but there's a handful of supplements that people are giving them that I think aren't effective and don't have any research behind them. So I would encourage people to try to look at what's been shown to be effective. And also sometimes there's just a lack of correlation, I think, between asthma and EIPH. And so I think if you have a horse that has EIPH, I'd certainly roll out asthma. Like I said, not every horse with EIPH has asthma, but if they do, I think it can contribute to how severe the EIPH is. So that's something we can look at to treat, as opposed to just directly treating the EIPH all the time.
Yeah, well, that's great. And I really appreciate you coming on to talk about this. You're so knowledgeable on the subject. So I'm sure this was very informative for so many of our listeners. Thank you so much to our audience for continuing to support Disease Du Jour. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.